So pneumonia is an infection in your lungs, and it could be caused by different microorganisms. It could be by viruses, it could be by bacteria, it can be even by fungus. And sometimes, we don't know. It's what we call cryptogenic. We don't know why it happens. It's one of those conditions that lately we have seen a rise in hospitalization as well, death rate on adults over 65 that are not immunized, as well on younger population that have chronic medical conditions and never been told or never been recommended to be immunized. We do have vaccines available. I really recommend and encourage my patients to get those vaccines. For example, you're 65 and you should be getting initial immunization with something called Pneumovax. That's one of the kind of our first vaccines that we have. And then obviously if you have previous pneumonia and there's a concern for resistant microorganisms, perhaps your physician will consider getting you the Prevnar, which is the an immunization for resistant microorganisms. Younger population, especially those that smoke, that already has COPD or have asthma, cystic fibrosis, or any of those chronic medical lung conditions, should be immunized too. So usually patients with pneumonia has many symptoms that come, to the hospital or the office inquiring for help, such as, for example, you start having high fevers, you start having shortness of breath, you start noticing a persistent cough, usually a wet cough. Your sputum might change in color. You might get very exhausted. You might have as well some what we call rigors. Those are like a chills, but kind of a little, more concerning. Usually physicians run some labs and get as well some imaging of your chest. So usually chest x-rays. So with those, we can determine, okay, there's a pneumonia. Now, sometimes we get as well a sputum culture to determine what is the microorganism causing the infection. And then we address the infection through that. In the hospital, when the patient comes in, immediately we get all of these labs and as well the diagnostic imaging, and then immediately start antibiotics. We usually follow guidelines either from the advisory committee of the chest physicians, which is a really good organism that give us some really good advices about how to treat these pneumonias, as well as locally wherever you work, what is the resistant rate based on microorganisms, and then we immediately set up a plan with which antibiotics should be used. Remember, pneumonias comes from different flavors, okay? They're like viral pneumonia, bacterial pneumonia, sometimes from fungus, cryptogenic, or the pneumonias that we don't know why they're happening. And there are a few that are like a community acquired, which happens in the community. Or there are another ones that are just happening within the hospital. We call those hospital-acquired pneumonia. So we do have immunizations. The immunization, these vaccines will help, on preventing for this pneumonia to get into something much more concerning. Perhaps, a big abscess or, sepsis. So the immunization should be, something that national-wise be recommended actively. And I do it here at Rois Medical Group. Some people don't believe in immunizations, but I can tell you that, we have noticed that with them reduce the rate of hospitalization and death, especially, in our adult, very debilitated patients. So usually when we have pneumonia, it depends on the level of the severity of the patient. There's pneumonias that we can we can diagnose here in the office. The patient's quite stable. They might be running some fevers, but the blood pressure is good. They're still having a good mentation, and sometimes it's early in the process that we can treat, with antibiotics, by mouth in the outpatient setting. Sometimes the patients are extremely sick that it will be better to hospitalize them and have a better and close monitoring of his condition. And sometimes intravenous antibiotics. There's a population which we call the autoimmune conditions. They have these biological treatments where these medicines depride the immune system. This patient should be very cautious about any symptom, any new symptom. So let's say my 7 years old comes from school and I have rheumatoid arthritis and I am on methotrexate medicines that basically deprive my immune system, so my condition is under control. So these patients are a higher risk for getting easily the infection, not as strong, not robust to fight the infection. So obviously these patients, either a cancer patient on chemotherapy or immunotherapy, an autoimmune condition on what we call immunomodulators, or the patient with, for example, HIV that is getting treated with the antiretroviral therapy. So those are three populations that I will be very, very concerned if there's an early symptoms like coughing, fevers, difficulty breathing, perhaps coughing some blood. Okay, and then there's another population, especially those that are unvaccinated patients over 65 that are never got a vaccine and they start having symptoms like this. Obviously they might be much frail population. It's quicker for them, the process, the infection, so they should seek medical attention as soon as possible. There's another population that I usually encourage them to or urge them that if you start having symptoms consistent with pneumonia, like what I just said, immediately seek for medical attention, especially those younger population that has some asthma or COPD. COPD is people that smoke, and then obviously already has some emphysema and chronic bronchitis, or perhaps asthma with COPD, or there's another condition called bronchiectasis. So all of these patients that they know, they've been told these conditions by either a pulmonologist or primary care physician. I urge this patient, if they start having symptoms consistent or suggesting or suspicious for pneumonia, to immediately seek medical attention. There's many other ways to prevent from getting sick. Obviously using the mask, especially when you are traveling. Try to stay away from sick people. It's not a common practice, but sometimes you can help yourself. You can help your immune system get a little more stronger, such as their antioxidants or medicines that help your immune system. Over in Italy, when we had this pandemia, we started listening and reading so many articles about vitamins that we can use. And then we start calling these the anecdotal therapy, so just vitamin D and vitamin C, and as well zinc, that will make a difference in your immune system. Get it much more solid, especially when this condition. Please follow up Rois Medical Group. You have the link and the website. We'll be happy to help you.